We have a couple minutes left, and I'm going to pose a couple questions and first start off with Doctors Volpp and Caraballo. Yeah, this is a hard one to think about as we're about to enter the green phase and start opening back up to non-essential office use. How do you think about the second wave that many are predicting? And how should that inform companies' decisions in going back to work? Can you give any insight into your perspective as you track this in terms of timing of that potentially? And again, what impact it may have on the going back to work practices that are being contemplated now for the green phase?
Well, I think it's important for us to look around us and see what's happening around the country. I mean, we've all seen the headlines that about half of the states, there's an increasing number of cases that have followed their opening up. Those of us in the Northeast, fortunately, have been in the situation, I think, because there was such extreme social distancing to have declining cases. But, you know, there's no preordained law of nature that dictates that's going to continue. I think that, you know, we're still in the first wave. We're all at very high risk. And as things open up, there's a very significant risk that number of cases, number of hospitalizations, et cetera, is just going to go right back up. And so I worry. I mean, I think a lot of health professionals worry that, you know, what does it mean to move to the green zone? I know there's criteria that have been set for doing that, but you look at some other countries like New Zealand, where there's 3 cases in the whole country. In Beijing, there are about 100 cases in a week led them to shut down Beijing. You know, and we're still having 100 cases a day and we're opening up. So a lot of that doesn't really make sense. I think that we're seeing that in other parts of the country. The number of cases is going up. They'll go up here too, if we're not careful. So I think we have to remain extremely cautious.
Dr. Caraballo?
Yeah, thank you. I agree with everything Dr. Volpp says. Those are really excellent points, and that what we're doing in our planning at Independence is we are assuming that we will have resurgences, and so we're trying to build in a very dynamic plan. It's not a binary process. It's home or in the office, that we will have the ability to flexibly move in and out of the office as required in smaller groups, and that you know, people, if they come back, will come back for shorter periods of time until we've established that there is some level of safety and normalcy.
Great, thank you. This next question's for Julie initially, but others certainly can answer it. And the question, Julie, is this: how are businesses, or how are you managing concerns for employees' privacy around their health conditions? You know, we've heard about the comorbid factors that contribute, and how are you dealing with that with your employees?
Sure. I can think of 2 different ways that this really is a consideration. One obviously would be if someone were to test positive, right? And our obligation to then communicate to individuals who have been around that person, whether that the fact that somebody has tested positive. So what we would do in that case would be to communicate to individuals who we know via our badging system or et cetera, that an individual within their workspace has tested positive, and, you know, we would then be implementing our procedures in that case, which would be to go and work from home and quarantine for the 14 days. We would not be releasing anyone's name in that sense. So that would be one scenario. Another scenario would be, which we have this a lot, an individual would come forward and say, you know, I am responsible for caring for a family member with a serious health condition, which makes them very vulnerable to this. As a result, I feel really concerned about coming back into the office because I don't want to bring anything home to them. And, you know, how can I handle this while still keeping my privacy, you know, in while still, attending to my privacy concerns, right? Because we certainly would not be sharing with other individuals their reason for wanting to work remotely, but we would honor their request to be able to do so. And we have had that within the few pockets of individuals at Vertex that have needed to come into the office during this time. We've been able to manage that. So as any good HR person would say, we need to manage these things on a case-by-case basis, and sometimes it just depends.
Last question, and then we're going to be out of time. I'll start with Ron, and then Drs. Volpp and Caraballo, you may want to intersect here a little bit as well. When this first started, there was a lot of anxiety around spread on surfaces. And I think as we've seen the data come back, it's the airborne nature of the disease that is is a greater concern. Ron, you're spending a lot of time cleaning surfaces, and that's obviously good and important. But I was really interested when you talked about airflow. I think a lot of people are going to become airflow junkies. Can you speak a little bit more about particularly what you're doing on that front within your commercial spaces?
Absolutely. Like you're saying, I think everyone has finally figured out the acronym IAQ with indoor air quality, because it is the hottest topic out there. Again, by flushing the air through our systems, by running our systems overnight, our number of hours in advance of the building opening, we're bringing through clean, fresh air. We are, again, everything we can do runs through our HVAC systems. So therefore, we are, for all intents and purposes, sanitizing that air as often as we possibly can, as best as we possibly can. And quite frankly, in our future buildings, we're looking at additional features around this, fortunately or unfortunately, in terms of UV lighting and all the other aspects out there. The key is that the science really hasn't caught up with it. So while, yes, as of today, they're saying that it's not on surfaces, now it's just in the air and it seems to follow that route, I don't think we're going to know for a few years. So we're going to be diligent in every process and just keep up with it, so that if, God forbid, they came back and said, well, you know what, we made a mistake, and by the way, it is on the surfaces, at least we know we've done our diligence. And when we do have a case, we use a Virex fogging and go to that next level to make sure and ensure that those spaces and those areas are cleaned and sanitized.
So an extension of that back to Dr. Volpp and Caraballo, this is going back to the office, but a lot of people are anticipating the opportunity to go back to restaurants and indoors in that case. Obviously, we've already been doing outdoor dining. Outdoor seems to be working okay, but as you think about indoor dining, I heard a statistic that talked about it's not 6 feet safe, it's more like 10 to 15, given the challenges on indoor air quality. Of course, we want to be supportive of restaurants, but any perspective, Dr. Volpp or Caraballo? You're on mute, Dr. Volpp.
Thanks. I think there are some important considerations there. I think there's the air quality. It's the fact that people won't be wearing masks, so they'll be eating. People may be talking loudly because restaurants are noisy. All of these factors make the standard 6-foot guidance perhaps insufficient in those kind of settings. So I think a lot of us are worried about that. It clearly is one thing to have people dining outdoors and being able to spread out with lots of fresh air. It's another to have people in indoor spaces where there's less circulation of air and maybe less room.
We've given a lot of information here. We're going to share this recording. You're going to get the opportunity to see some of the charts that were shared this afternoon. I want to thank all of our panelists for sharing your wisdom, your insights, and all the work that you're doing on the front lines and also behind the scenes within your companies. Thank you all for participating today. Again, thank you to our sponsors. Want to also talk to you about upcoming programming, but again, recognize the sponsors of our Talent Connect series.